Maria Cristina Raimundo, Program Manager of PWD Program from the Disease Prevention and Control Bureau, and Mr. Armand Argales, Supervising Health Program Officer from the Health Promotion Bureau. From the Department of Labor and Employment, we have Mr. Chester Ray Mulato, Senior Labor Employment Officer. From the Second Congressional Commission on Education, or EDCOM-2, we have Ms. Kate Anion Nuevo, Chief Technical Specialist. From the National Council on Disability Affairs, or NCDA, we have Attorney Walter Jason Alava, Regional Programs Coordinator. From the Early Childhood Care and Development, or ECCD Council, we have the Executive Director
Recording
and
in
Vice Chairperson,
progress.
Dr. Teresita G. Inchong, and Mr. Edwin Talion, Planning Officer 3. From the National Nutrition Council, or NNC, we have Ms. Maria Lee Alpuerto, Nutrition Officer 4, from the Nutrition Policy and Planning Division. And from, we're still waiting, sir, for the representatives of DILG, the Leagues of Provinces, Leagues of Cities of the Philippines, and the Liga ng mga Barangay sa Pilipinas, and DOF. Thank you, sir.
Thank you very much, Comsec. Today will be, the agenda for today is the status of the implementation of Republic Act number 11650, or the instituting, or entitled Instituting a Policy of Inclusion and Services for Learners with Disability in Support of Inclusive Education Act. And admittedly, this bill is one of the most comprehensive, as well as it underwent a lot of different processes to reach this point. We conducted 2 public hearings, 10 technical working groups. On top of the 10 technical working groups, we had 10 pre-BICAM sessions to reconcile the House and the Senate version. We had 2 bicameral conference meetings to, again, reconcile the 2 versions. And after reconciling it, we had 3 post-BICAM. In post-BICAM is actually unique. But since after the BICAM, we still had some issues to attend to, the team conducted 3 post-BICAM sessions. And all of this happened between January 23 of 2020 to December 1 of 2021, almost 2 years because of the pandemic. And I remember we had to conduct all of these activities online, obviously because of the pandemic, and the offices were closed. But despite that, the stakeholders, this representation, and the other government agencies such as DepEd deemed this one of the most important bills that we have to push. And despite the challenges of the pandemic, we went through and enacted the law on March 11, 2022. And the law is very simple in nature. The law provides special services and special support services to learners with disabilities so that they can receive the best education possible. And this inclusive education law is a landmark law. It puts the Philippines on the same plane with other advanced nations, especially with the different conventions that we have signed on persons with disabilities. And this law, like I said, it underwent a lot of processes, and a lot of stakeholders were invited to share their knowledge and their wisdom in crafting this law. So now that we have the law in place, signed on March 11, 2022, we want to hear from our stakeholders, particularly the Department of Education, where we are in terms of implementing our inclusive education law. Again, this is for the benefit of our learners with disabilities, and our learners with disabilities should be given and accorded with the same quality education like everyone else. And we also have to recognize that our learners with disabilities need additional support, additional special support in order for them to keep up with their educational needs, and hopefully after graduation to keep up with their goals in life. So we invited the different government agencies who are responsible to implement this law to its fullest. We know that there are challenges, both budgetary challenges, both coordination challenges. We also have challenges in terms of implementing the details of the law. So we want to discuss that today. We want to hear from from our government agencies what are the challenges that they are facing, and what are the and how the Senate can help them overcome these challenges so we can fully implement the law. So with that, we will start off with, we requested the Department of Education to present the status of the law, and then later on we will request everyone to participate and to share with us their insights and their opinion on the implementation of the law. Right? So we recognize ASEC Torio.
Honor, Senator Win Gatchalian. Let me also extend my greetings to all led by our Secretary. Secretary Sani Angara is very pleased to be part of this committee hearing. As mentioned earlier by His Honor Chair Win, DepEd actively participated during the deliberations of this law. And we are very happy that the law was finally passed or enacted after the several endeavors participated in not only by DepEd but by all stakeholders. We have prepared report on how DepEd had implemented the law, and we are very pleased to share with everyone the progress of the implementation of the law. But just like other programs, we also had encountered challenges. So we are not only sharing here with you the accomplishments that DepEd had done after the enactment of the law, but just the same, we would like also to mention some of the challenges. For after all, as expressly mentioned in the law, the implementation of this law requires the whole of nation approach. As mentioned, I am joined by my colleagues. Let me mention that BLD, or Bureau of Learning Development, led here by Director Lay. The Bureau is composed of two divisions, and one division is the Student Inclusion Division, which closely supervises the implementation of our inclusion programs, which include yung special needs education. And I am also joined here by our OIC Director, who is in charge of the Bureau of Curriculum Development. As you may know, one of the provisions, as stated in the law, is the provision of modification, which include the accommodation, which include the availability of transition curriculum for our SNED learners. So with that, Mr. Chair, Your Honor, I'm very pleased to please allow Direct Lay to deliver or share with everyone the report of DepEd. Thank you very much.
Go ahead, Director Ariola.
Good morning, Mr. Chair and everyone present. So I'd like to start our presentation with the requested data sets for special needs education. Next slide, please. So I'd like to provide you the data on the number of municipalities and cities with SPED centers per region. As we know, we have 431 SPED centers all over the country, and these SPED centers are located in 365 municipalities all over the country. So on screen, or the specific number of municipalities per region. So all in all, we have 365 municipalities with SPED centers. Next slide, please. As to the number of schools offering SNED programs per municipality, we have a total of 22,235 SNED schools all over the country. And on screen is the breakdown of SNED schools by region, totaling to 22,235. For the data on the number of inclusive learning resource centers established in each city and municipality, disaggregated by region. So for fiscal year 2021 to 2022, so this is composed of 2 batches. So we were able to convert 32 SPED centers all over the country, and each region is, has a SPED center converted into an ILRC, which means to say that of these 32, there are 2 SPED centers per region converted already. Next slide. So those are the municipalities with converted SPED centers already. As to the total number of Plantilla positions created in field, for our SNED teachers, we have a total of 5,147 for now. And then for our ILRC, we actually requested and included in our proposal in the 2025 budget 9 positions for each of the 32 ILRCs. And on screen are the 9 positions. So 1 ILRC supervisor per ILRC. We have occupational therapist, speech, language pathologist, reading specialist, FSL specialist, physical therapist, administrative officer, and administrative assistant. Some of which of these positions will form part of the MDT, the multidisciplinary team. Some other members of the multidisciplinary team will be requested as or they'll just be a part-time. They'll just be providing part-time service to the ILRCs. So this is the multidisciplinary team, as I have mentioned earlier. These are the only positions that are included in the FY 2025 plan. I'd like to mention, Mr. Chair, that we already trained in the Department of Education core trainers for the multidisciplinary team. So which means to say that as soon as we're able to hire this the members of the multidisciplinary team, then we'll be ready already to train them. For our enrollment data, unfortunately, Mr. Chair, we do not have the official data yet for school year 2024-2025. It's still, they're still cleaning the data. So for now, what we can present to you is our enrollment for school year 2023-2024. So that putting together our enrollment for school year 2023-2024 for both public and private, so we have a total number of 324,968. And then for the public schools, we have a total number of learners with disabilities of 295,666. And for our private schools, we have 29,302. We further disaggregated the data. So we tried to look into the number diagnosed by our licensed specialists, so that The total mainstream with diagnosis for the public school is 59,878. For the private schools, we have 13,407. For the self-contained with diagnosis, 9,306 for the public schools and 5,915 for the private schools. And then the total non-graded with diagnosis, we have 58,087 for the public schools and 5,167 for the private schools. So that for the public schools, we have a total number of learners with disabilities diagnosed by licensed specialists with a total number of 127,271. For the private schools, 24,489, a grand total of 151,760. I'd like to show you also, Mr. Chair, the number of our learners diagnosed based on manifestation. So, but this is a data for school year 2023-2024. I'd like to check that kasi hindi namin na-correct yung sa task po. Sorry for that. So total mainstream with manifestation, we have 145,944 for the public schools, 3,843 for private. For the total self-contained with manifestation, 2,822 for the public schools and 791 for the private. And then total non-graded with manifestation, 19,629 for the public schools, 179,000 for private. So we have a total number of 168,395 for learners with disabilities diagnosed based on manifestation in the public schools, while we also have 4,813 for the private schools, having a total number of LWDs diagnosed based on manifestation of 173,208. For our status of the learner information system, this is an update as to what specific sets of information that are being captured. So on screen, next slide please. On screen are the exceptionalities that are actually included in the LIS, so that from these exceptionalities we're able to determine the number of learners in each of the exceptionality. Next slide. So this is also an update, Mr. Chair, on the child fine system. So the child fine system is yet to be established in 2025. So we requested an amount for fiscal year 2025, but it actually formed part of the wish list. So that if our wish list will not be granted for this, then it would be a challenge for us to be establishing the child fine system. So, however, it's important, Mr. Chair, to mention that even without the child fine system yet in the Department of Education, we're able to capture actually our basic education learners using our established child fine policy. So we have a specific child fine policy for our learners with disabilities in the Department of Education. So unfortunately, we're not able to capture or to gather data or to look for the learners for LWDs below 5-year-old because they're not yet with basic education. Okay. And then data or performance matrix are available to assess its effectiveness, so we don't have any available data yet, Mr. Chair, because it is yet to be established. So that's all, Mr. Chair, for our data sets. For the other slides, that's actually an enumeration of all the schools with SNED program. So we'll just provide you a copy of this. Okay.
Thank you, Director Yola. I have here some presentations on the status update on the implementation.
Yes,
do,
Mr.
do you want,
Chair.
do you want to?
That's another.
Do you want to? Because that's the agenda for today. The aside from the statistics that you mentioned, um, what is the status of the implementation of the law, particularly important provisions of the law. You mentioned child fine system, ILRC, but there are also other very important, relevant provisions of the law. I think we should discuss that just to put that on record.
Yes, Mr. Chair, we have already presentation for that.
Okay, let's proceed with that so that everyone
Okay.
will be guided.
So I'd like to share you also the status update on the implementation of Republic Act 11650. So the first question asked of us is what progress has been made in implementing the RA 11650 since its enactment in 2022, actually March 11, 2022. So next slide, please. Mr. Chair, we have to inform you that we have already drafted the implementing rules and regulation. It was signed actually on July 18, 2024. However, we are still awaiting for its publication. So we were told by LLO that the publication is going to be within this week. At first, it was December 2, so we have yet to find out whether it has already been published, Mr. Chair. And then we have already drafted also the multi-year roadmap for 11650. But of course, we still have to wait for the issuance or the publication of the IRR for us to be able to finalize this. In fact, we have already submitted a call for the membership of applications to the advisory committee for education of learners with disabilities. It's actually under current review by the legal and legislative office and awaiting the issuance of the IRR. When we followed this up, Mr. Chair, I think they are done already reviewing the call for submission. However, we got a message that there's a need for us to await for the issuance of the IRR. So that the moment that we'll already be able to organize our advisory committee, we'll be able to finalize the roadmap, and the IRR shall have been issued. The interagency coordinating council can already be convened. In fact, we already have a letter addressed to the secretary for this. So the moment that the IRR is going to be issued, then then the ICC can already be convened, Mr. Chair. And then it's also important to mention that we're able to hire also already personnel for the secretariat for RA 11650. So we now have one technical assistant, one technical assistant 3 technical assistant 2, and one technical assistant 1. So the secretariat is now functional. They're working with us, particularly for some other requirements of the law. In the next slide, it shows us actually the policies that we were already able to develop. But of course, we cannot finalize this until such time that we're able to, we cannot issue this unless the IRR is going to be issued, because some of these policies make reference to the IRR, Mr. Chair. So that we have scheduled already a consultation with internal and external stakeholders on December 9 to 11, particularly on the revised policy on the implementation of the multi-factored assessment tool, the manual of operations of inclusive education, the policy guidelines on the operation of inclusive learning resource centers, and then the policy guidelines on the implementation of distance education for learners with disabilities. We have also the policy guidelines on the management and implementation of the transition program for learners with disabilities. We also have drafted already, and for routing to internal stakeholders for comments, the policy guidelines on individualized education plan for learners with disabilities. I mentioned earlier, Mr. Chair, that we're done actually training our core trainers for the IEP so that as soon as the IRR will be issued, then we can already fast track also the issuance of these policy guidelines on IEP. Then we also have the policy guidelines on the adoption of the Filipino Sign Language as the medium of instruction in basic education. So, Mr. Chair, those are the policies that we have drafted ahead, even without the issuance yet of the IRR. And then, as to the provisions, we listed down, Mr. Chair, some of our accomplishments per provision of the law. Next slide, please. So the first objective is to provide learners with disabilities free and appropriate public early and basic education and support and related services based on their needs. And the second one is to establish and maintain ILRCs in support of their inclusion in the general education system. So it's important that we have to mention, Mr. Chair, that we are providing free basic education to 295,666 learners with disabilities. Program support funds are also provided for the assessment and participation of learners with disabilities to co-curricular activities for the procurement of assistive technology and devices and immersion programs. And then I already mentioned about the conversion of 32 SPED centers into ILRCs covering fiscal year 2021 to 2023. And then we also downloaded funds already for the conversion of 21 SPED centers for fiscal year 2024, Mr. Chair. So for fiscal year 2024, we have 21. And then for fiscal year 2025, we also propose another 16 for conversion, but we also propose new construction for 2025. And then included in our budget for 2025 is actually the hiring of the some members of the multidisciplinary team for the 32 ILRCs. So these are all programmed in 2025. Next slide, please. On the objective to provide learners with disabilities access to general education system through formal school systems, including the implementation of alternative delivery modes. So we have developed policy guidelines on the implementation of distance education for learners with disabilities, and it's now for refinement and consultation with stakeholders by the second week of December. We also prepared developed learners materials in accessible formats, and then there's the provision of assistive devices and gadgets. In fact, the budget of this, Mr. Chair, forms part as eligible expenditure in the program support fund that we have downloaded, and of course the transition program. We already have a curriculum for the transition program. So what we're finalizing and about to be issued is the policy guidelines on the implementation of the transition program, Mr. Chair. Next slide, please. For letter D, to ensure that learners with disabilities develop their full potential towards self-sufficiency and become fully participative members of society. So we have developed the policy guidelines on the management and implementation of the transition program for learners with disabilities, and I mentioned earlier that this is for consultation with stakeholders by the second week of December. So we have an established transition program, and then we have events, or we have programs particularly for disability sensitivity and awareness program, Mr. Chair. And then for letter F, to further develop a system for identification, referral, and intervention for learners with disabilities. So and to identify through the Child Find System learners with disabilities. So I actually mentioned earlier, Mr. Chair, that this is programmed for 2025 for the Child Find System. However, under DepEd Order number 23 series of 2022, we have the Child Find policy for learners with disabilities towards inclusive education. But I'd like to mention, Mr. Chair, that other than this policy, other than this child fine policy for learners, child fine also is also captured in the early registration issuance of the Department of Education. Next slide. To institutionalize the development, implementation, and review of the individualized education plan, I mentioned earlier, Mr. Chair, that we have already developed policy guidelines on individualized education plan for learners with disabilities. It's due for refinement and consultation with stakeholders by the second week of December this year. And we have gone ahead orienting actually our core trainers on the development of IEP for multidisciplinary team of ILRCs. And then to provide parents and guardians of learners with disabilities with information and opportunities to actively participate in the determination of educational placement options, to enable and empower all teachers, including those with disabilities, parents, guardians, and family members, by training and then to train and equip all teachers, including child development teachers and workers. So we already conducted training and orientation and development of the IEP. And it's important, Mr. Chair, that we report to you that we already requested the streamlining of the qualification standards for the special needs education teachers to align with the regular teachers' career progression. So we're working with this, with that of the BHROD. Next slide. To establish an effective consultative mechanism that will actively involve learners with disabilities. So we already called for, we already drafted actually a call for the submission of membership applications to the Advisory Council, and included in the invite is our student leaders for inclusion. So I mentioned earlier that this is under current review by the LLO. And then we have scheduled conduct of surveys, FGDs, through the student government organizations for this, Mr. Chair. Okay. So for the next slide please. How is DepEd addressing the conversion SPED centers to ILRCs, and what challenges have been encountered in this process? So this process actually required regional offices to identify and nominate eligible SPED centers for conversion, which were subsequently validated by the DepEd Central Office. Validated centers were included in the pool for conversion to ILRCs. So meanwhile, SPED centers without available rooms for conversion, but with sufficient buildable space, were designated as sites for the construction of new ILRC. So we have DepEd Order number 45, series of 2021, entitled Policy Guidelines on the Selection of and Minimum Requirements for the Conversion of Certain Schools with SPED Centers into Prototype ILRCs. For now, Mr. Chair, this is the DepEd Order that we are using to guide us in identifying the SPED centers for conversion. And then for the challenges, there's actually a limited pool of personnel available to organize the multidisciplinary team, especially the availability of developmental pediatricians. So we learned that there's just, in the country, there's just about 96 developmental pediatricians, but of these 96, there are just very few who are in the country actually. And then limited funding allocated for each year for the conversion of SPED centers. We're saying this, Mr. Chair, because we're just limited to at least one SPED center per region because of the budget. But should we be provided more, then we can convert more of our SPED centers each year. Okay, next slide. What steps are being taken to ensure that ILRCs comply with accessibility standards, Batas Pambansa Bilang 344, and adopt the universal design principles? So I'll just share you, Mr. Chair, what we have, what we're able to research on this. But should there be any representative from DPWH, then of course, the representative or the source person can always supplement. So with the recent release of the 2024 revised implementing rules and regulations of BP Bill Bilang 344, DepEd had a meeting with representatives of DPWH and discussed the following concerns. So the Bureau of Accessibility, in consultation with the Bureau of Design, will review the proposed classroom designs for inclusive learning resource centers. And it was further clarified that the revised implementing rules and regulations of Batas Pambansa Bilang 344 shall only affect ILRCs which are yet to be constructed. Next slide. So, DepEd actually must comply with the revised Batas Pambansa 344 IRR in its construction of the new ILRCs. Further, it may opt actually to adopt the revised IRR in the conversion of the SPED centers into inclusive learning resource centers based on the results of the assessment of existing ILRCs. And then the Bureau of Accessibility, in consultation with the Bureau of Design, will review the proposed classroom design for ILRCs. And then the IRR of Batas Pambansa Bilang 344 shall only affect the ILRCs which are yet to be constructed. And then the DPWH, through the Bureau of Accessibility, conducts an annual audit of public and private elementary and secondary schools to ensure compliance of BP 344, and the Bureau of Accessibility reiterated that structures must comply with the accessibility law beginning from design until construction phases. And we are happy for this, Mr. Chair, because we've been asking actually for the implementation of the accessibility law. And then how effectively, next slide please, how effectively are ILRCs delivering the mandated services under Section 7, such as implementing the child fine system and preparing the individualized educational plan? So, unfortunately, Mr. Chair, we don't have yet the child fine system. But we'd like to say that ILRCs are effectively delivering mandated services, such as but not limited to the following. From the 32 ILRCs, we have ILRCs that are already partially operational with medical and allied professionals that professionals who ensure that the IEPs are actually developed in collaboration with parents, teachers, specialists, and that they reflect the child's unique learning profile. I'd like to mention, Mr. Chair, that for the partially operational ILRCs, our schools are actually in collaboration or in partnership with LGUs and with some other associations, organizations in their respective areas. And then with the establishment of the child fine system in 2025, it will ensure that all learners with disabilities are located, identified, and receive timely intervention and support. So, next slide. I already mentioned of the current status actually of the child fine system, Mr. Chair. It's included actually in our 2025 budget. And then next slide, what are the planned next steps for fully operationalizing the system? And thus, the 2025 budget include funding for this initiative. So the child fine system, next slide please. Previous. Previous po, ayan. Yun po. Okay. The child fine system is yet to establish in this 2025, and these are the essential features actually of the child fine system. Oh, okay. Before I go to that, so we need funding for its procurement. So we're going to develop a system tailored to the needs of learners with disabilities. There's going to be an integration of database into the new system for better tracking. So as we know, Mr. Chair, we actually have our LIS, but I think with our child fine system, it's going to be a separate one from that of the it's going to be a separate one from the LIS. And then there's a need for us to train key personnel on how to use the system effectively. And this does not only include personnel from that of the Department of Education, but also from ECCD and from DOH because of the consideration of the zero age and LGUs also. And then campaigning for awareness to engage all possible stakeholders, initiating a pilot phase to test the system and gather feedback for improvements, expanding the system nationwide after successful piloting, and then monitoring systems performance and making necessary adjustments, and then coordinating with other agencies to provide comprehensive support for learners with disabilities. We see, Mr. Chair, that for us to be to be successful actually in the implementation or in the utilization of the child fine system, we really have to work with local government units because we need enumerators to really locate our learners with disabilities wherever they are in the country. So I just would like to mention, Mr. Chair, some of the essential features of the child fine system. So one is the module for identification. Another one is a centralized database, and we'll make sure that the child fine system will have a secure, accessible storage of all collected data, compliant with the Data Privacy Act. There's going to be a comprehensive learner profile. So database entries includes age, type of disability, educational background, and other relevant information for personal health, social, and educational interventions. And then continuous tracking. The system tracks the progress of learners over time, ensuring they receive the necessary support. Referral mechanism, automatic referrals to appropriate educational, health, or social services based on the learner's needs. And then we have the interagency data integration. And this is going to enable data sharing across government agencies like DepEd, DOH, DPW, DSWD, LGU, to provide a holistic response to the needs of learners with disabilities. Of course, Mr. Chair, these are just what we have listed for now, but we still are wanting for more inputs coming from our from the other concerned agencies when we get into the development of the child fine system. Okay. Next slide. Next slide, please. So for the Advisory Council, it has yet to be organized, Mr. Chair. But I mentioned earlier that we already have drafted the call for the submission of membership applications. So as soon as the IRR is issued, I know that we can already release this call for submission. And then next slide is all about the Interagency Coordinating Council for Learners with Disabilities. So I also mentioned earlier that we have already sent a letter to our DepEd Secretary requesting for the convening of the Interagency Council. However, it's actually under review by LLO, awaiting also the issuance of the IRR. But it's important to note, Mr. Chair, that even without the issuance yet of the IRR, we have already taken a lot of steps. We have concrete actions already to meet some of the requirements of RA 11650. Next slide. So what progress has been made in formulating the national policy on inclusive education? So in place, Mr. Chair, is DepEd Order number 21 series of 2019. And Annex 5 of DepEd Order 21 series of 2019 is the inclusive education framework for basic education. So we have that in place. And then we need to get back to some of our existing policies relative to inclusive education, particularly special needs education, and because we have to align them with that of our with the IRR of RA 11650. Next slide. So has DepEd developed a multi-year roadmap with annual work and financial plans? Our answer, Mr. Chair, is yes. We have already started developing the multi-year roadmap with the agencies and organizations that needed to work with us. But it has yet to be presented to the Advisory Council for their comments and inputs, and eventually to the Interagency Coordinating Council. So, Mr. Chair, we have the draft here, but we cannot finalize until such time that we're able to have the IRR released also. And then, how is this being monitored and evaluated? What will come actually with the multi-year roadmap, Mr. Chair, is a monitoring and evaluation tool. And this is the monitoring and evaluation tool is going to be anchored on the basic education monitoring and evaluation framework of the Department of Education. Next slide. So what policies and guidelines have been issued to safeguard learners with disabilities from abuse, bullying, discrimination, and other prejudicial acts? So DepEd actually issued the memorandum OMOU, Office of the Undersecretary for Operations 2024-205, 011-1115, titled Guidelines on the Implementation of Safe Spaces Act in Basic Education. And so the said guidelines clearly outline the duties and responsibilities of each governance level in implementing the Safe Spaces Acts. It details also punishable acts under Section 6 of the law, specifically addressing gender-based sexual harassment in schools, and then explain intervention and referral mechanisms. This is on Section 18, to ensure the protection and welfare of learners experiencing gender-based sexual harassment, and then mandate the creation of the Committee on Decorum and Investigation by school heads to serve as the primary body for investigating violations. And then there's a reference to the Child Protection Committee as provided under DepEd Order number 40, series of 2012, entitled the DepEd Child Protection Policy. So in compliance with this memorandum of the operations strand, the regional offices have issued corresponding regional memoranda to ensure localized implementation of the Safe Spaces Act in basic education institutions. So these are actually the DepEd orders that support our learners with disabilities. We have DepEd Order number 40, series of 2012, which is the DepEd Child Protection Policy. It reiterates guidelines to protect learners from abuse, violence, exploitation, discrimination, bullying, and other forms of abuse. We have also DepEd Order number 44, series of 2021, entitled Policy Guidelines on the Provision of Educational Programs and Services for Learners with Disabilities in the K-12 Basic Education Program. This policy actually ensures that the rights of learners with disabilities are respected, protected, fulfilled, and promoted for equal and equitable access to quality basic education. And then we also have the last one, DepEd Order number 42, series of 2021, titled guidelines on the utilization of program support funds for special education or special needs education. And so the policy provides guidelines for the effective utilization of program support funds for special needs education programs, ensuring that learners with disabilities receive adequate support to achieve equitable learning outcomes. Next slide. How are procedural safeguards ensuring the rights of learners with disabilities and their parents or guardians? So the procedural safeguards play a critical role in ensuring the rights of learners with disabilities and their parents or guardians by establishing clear and protective measures that promote fairness, transparency, and accountability in educational settings, and ensuring that learners with disabilities receive the support they need and that their parents and guardians have a voice in decision-making process related to their child education. So we have actually the student the SGC, the School Governing Council, where our parents are actually supported, Mr. Chair. And then, what mechanisms are in place to address grievances and complaints? So, to address grievances and complaints related to learners with disabilities, several mechanisms are in place to ensure accountability and fairness, to include grievance redress mechanism. Schools have systems to resolve complaints locally, even though informal steps and formal process, if needed, involving written complaints and investigations. We also have the child protection committees. Each school has a child protection committee to handle issues related to student welfare, and that includes our learners with disabilities, including cases of abuse or discrimination. Serious cases may be referred to higher authorities. And then Committee on Decorum and Investigation. This committee investigates gender-based harassment and other violations in schools, ensuring due process and complainant protection. And then we have a due process and dispute resolution. So DepEd provides formal process like mediation and hearings for unresolved grievances. Parents can also seek legal recourse if needed. Mr. Chair, we also have complaint hotlines and online platforms. So DepEd offers hotlines and digital tools for filing complaints, ensuring accessibility and prompt responses. And then we also have feedback and suggestion boxes. Schools offer anonymous complaint submission through suggestion boxes regularly, which are actually regularly monitored by administrators. So, Mr. Chair, those are our updates that we can offer for now, particularly on the implementation of RA 11650. Thank you very much.
Thank you, Director, for the very comprehensive updates. I just have basic questions that I took note from your presentation. One is the implementation of the law and the IRR. The law was signed on March 11, 2022. And then I saw in your presentation that IRR was signed July 18, 2024, almost 2 years after. But the IRR is not yet implemented, not yet issued. What can you explain? Why is it not yet issued? Why, and what's the meaning of not yet issued? It's already signed.
Yes, Mr. Chair, but I think it needs a it needs to be published.
So what's December na ngayon, 2024? What's holding the publication?
Mr. Chair, if we have a resource person coming from the LLO.
I think we should
they
put
can
this
better.
in order because we have a lot. Actually, this is a common problem in many of the departments. We have the law. We don't have an IRR. We have an IRR, but it's not yet perfected because it's not published. No? And if you look at the timetable, from the law to the IRR, it's 2 years. From the IRR to now, it's 6 months. So but without publishing it, it will not be a perfect process. No? So when do we see the publication to happen?
Mr. Chair?
Yes. Is there someone who can?
Mr. Chair, the information that was given us is actually December 2. That's why the consultations that's why we scheduled consultations also after December 2 para safe na. So hopefully, lumabas na kahapon.
So December 2 is yesterday.
Yesterday.
So it should be published yesterday.
Yes, that's our expectation, Mr. Chair. Kaya yung mga activities na po namin for the City Strand, specifically the Bureau of Learning Delivery, talagang nag-schedule na kami after December 2 para safe na sana kami. Because most of our policies refer to the IRR, Mr. Chair.
Do we have any information that it was published? Do we have anyone from
Mr.
DepEd? Because you guys should talk.
Mr. Chair, we have a representative, I think, from LLO.
Can someone, you're one department. Siguro mag-text na lang ako, mag-Viber groups na lang kayo para, because it's quite disappointing that it took 2 years to craft the IRR. And after crafting the IRR, 6 months thereafter, there's no publication yet. So, in other words, some of the provision, not all, but some of the provisions of the law cannot be implemented because IRR will spell out the details. No? So what
Unfortunately, Mr. Chair, we don't have... Okay.
Thank
Go-
you,
go
Your
ahead.
Honor.
Yeah.
We will closely coordinate with our office or strand, which take charge of the issuance of the IRR, especially for this law. The latest information that I got is it's for publication for general circulation. Po, based doon po sa law. We will
But also in your IRR or in the law, the IRR will take effect 30 days after the publication. So in other words, even though you publish it tomorrow, it will only take effect 30 days after. So my point of the matter there is, by the time we fully implement this law, it's almost 5 years, because it took us 2 years to draft the law. It took you 2 years to draft the IRR, and then another 6 months to publish it and fully operationalize it. So almost 4.5 to 5 years. That should not be the case. That's why we enact this law, because we find it important, we find it necessary, but it's up to the department to operationalize it. No? But this is purely, it was purely engulfed in the bureaucratic process. There's nothing, I don't think it's going to be complicated to publish it. No? It's just publishing, going to the official gazette or going to a newspaper, just publish it. So what's holding the publication? Do you have any information? Is that kayo ba yun, Director Ariola, who publish it, or is it a different group?
Actually, it's a different strand, Mr. Chair.
Which is which
the
strand?
legal...
The legal strand. Is
Yeah.
there anyone from the legal strand here
Yeah.
who can answer? But nevertheless, since BLD is the implementor, diba? In Bureau of Learning Delivery is in the law is the implementer, I would suggest that you take charge. Like I said, gawa na lang kayo ng Viber group. Lagay nyo na, pati si Secretary Angara, lagay nyo na doon para... because it's quite disheartening that
Yes.
after implementing the law, it's already 2.5 years, but we haven't, even IRR, hindi pa natin nakikita. We haven't seen the IRR.
Actually, Mr. Chair, we're also in close coordination with LLO. And that's why, even without the IRR, we drafted ahead some of the policies that are actually required by the law para hindi na po inantay. Even for the multi-year roadmap, Mr. Chair, we had to go ahead developing it para the moment that it's issued, then it will be easier for us already to convene and finalize.
Oh, well, that's why we, in Section 36 of the law, we actually anticipated that. There's a provision here, notwithstanding the non-issuance of the IRR, this act shall take effect 15 days after its publication in the official gazette or in a newspaper of general circulation. Because we saw this in many of the laws that Congress and the Senate are being pressed to pass, but not implemented because of the lack of IRR, and in this case, the lack of publication. The IRR is there. No, actually, nakita ko yung IRR, it's here. But it's not published. No? So, in other words, without publishing it, you cannot operationalize this. Nevertheless, we included in the law a self-operationalization provision, meaning those provisions that can be implemented without an IRR. Because the IRR naman, the objective of that is to put details into some of the complex implementation. But if it's not as complex, for example, formation of the committee, formation of the council, because I don't think you need complicated process for that. You can already self-operationalize those provisions in the law. So my suggestion is, and I would like to urge the department to already publish the law, publish the IRR, those items in the law that can be implemented, let's implement it already. Because we owe this to the parents of the learners with disabilities, we owe it to the groups who participated, of course we owe it to our learners with disabilities. That's the whole point of enacting this law, is to provide special services, support services to our learners with disabilities, so they can be provided with quality education. It goes hand in hand. Alam niyo naman yan, the special needs, support, and also education. But without the IRR, it's going to be very difficult to implement some of the detailed provisions of the law. So I would, kausapin niyo lang si Secretary. In fact, kasama siya dito nung kinraft namin to. So that we can already fully implement the law. Because that's dismaya na because of red tape, we cannot implement the law. So please talk to the Secretary and to your legal department. And the other, let me, some of the provisions in the law can be implemented right away without the IRR. And one of the most important provisions that we included here is the creation of the advisory council, advisory committee. Here, Advisory Committee for Education of Learners with Disability. And this is to, I remember this provision very clearly, very vividly, when the stakeholders suggested this. They strongly suggested this because they want to have a voice in policy making, in short. And they want to have a voice in the implementation of the law. And I understand from your presentation, this has not yet been implemented, or na-implement na ito?
Not yet, Mr. Chair. We actually have already drafted the call for the submission of application for the membership of the advisory committee. But the document actually went to the LLO.
Again?
And it's,
LLO, the legal again?
yes.
Pag pumupunta doon, parang di na lumalabas eh.
Yes, and then it's from the information we got from them, Mr. Chair, we have to await the issuance of the IRR.
So we go back to square
IRR.
one, the IRR. No?
For the
But in
publication.
this case, it's quite, because nga, we were anticipating delays in the IRR, so we included that provision. But in this well, nakasulat kasi rin dito, the composition of the committee and the
Yes.
qualifications in terms of office of its member shall be stated in,
In
the
the IRR
IRR.
po.
No? So that's
Yes.
why we go back.
Yes po.
Yeah, but we also crafted here language that organizations of persons with disabilities and other NGOs and relevant stakeholders are part of the committee. So,
Yes po.
but again, we go back to the IRR. So again, can you after this oversight hearing, please talk to your legal department, to the secretary, so that we can already publish this. Pautangin ko na muna kayo kung kailangan mag-publish. No, newspaper lang naman to of general circulation, bayaran nyo na lang ako later on. No, para lang ma-publish na natin. No, kasi it's kagaya itong council, we cannot advisory committee, we cannot move forward without the IRR. No, even though we put the organizations, but it's specified here that the qualifications, no, the qualifications will be spelled out. No. The other one is the another provision here that we talked about in length during the TWG is the Interagency Coordinating Council for Learners with Disabilities. I understand this has not yet been implemented. So what's the status of this? Ito hindi na kailangan ng IRR to because no, the DepEd Secretary as chairperson, DOH Secretary as co-chairperson, the SWD Secretary. So you don't need qualifications here. These are ex officio members. No? So have you convened or operationalized this?
We have a letter
Yes,
already, Secretary.
Yes, Mr. Chair. Let it be put on the records that our representation here, after our representation here, we will closely work with OSEC and our LLO for the publication of the approved IRR. Let it be reiterated that we have yet to convene the IACC as well as release the invite for the advisory council pending the release of the pending the publication of the IRR. But as mentioned earlier in our report delivered by Direk Ariola, all the documents which include the letter of invite or the call for our organizations to form part of our advisory council. These are all ready, including the invites for the offices as mentioned in the law, which will compose the IACC. Ready na po ito, including may heads up na rin po sa secretary na once sa calendar po niya na once na na-publish na po yung IRR, the IAC which he will chair will be immediately convened po.
The IACC, I'm reading the law right now, doesn't need an IRR because ex officio members na ito eh. Automatic, like for example, the DOH Secretary as co-chairperson, the DSWD Secretary as co-chairperson, the members are DPWH Secretary. Of course, they will send their representatives. No? But these are self-executing positions. So in other words, in my opinion, you don't need an IRR to convene this. And the law mandated the BLD, Bureau of Learning Delivery, as the secretariat. So in other words, the BLD will be the one calling for the meeting, organizing, calling for the meeting, and all that. No? So wala pa rin. This has not yet, you haven't convened the IAC. The reason why I'm also putting emphasis on this is because of the multi-year roadmap. No? In the functions, ensure the preparation and regularly review a multi-year roadmap supported by annual work and financial plans for the effective implementation of this act. So during the debates before, the senators recognized the complexity, enormity, and the budgetary requirement of this law. So one of the suggestions from the senators is to come up with the concept of progressive realization. And in order to do that, you need a roadmap, no? To realize it progressively. So, but the thing is, the roadmap will be created by the council, the interagency council. So without convening the council, we don't have a roadmap. If we don't have a roadmap, we don't have a way or a vision to implement this law.
Your Honor, Mr. Chair, we are ready with the roadmap. The crafting of the roadmap had been participated by the different stakeholders, but I might be wrong, but there is a express provision in the law which says that the advisory council will recommend the roadmap to the IACC. So pending the creation of the advisory council, we cannot, and pending the convening of the IAC, we have yet to
Yes,
release
oo.
the roadmap po.
Because-
But yes, Mr. Chair, we will go back to our LLO and OSEC if we can immediately convene na the council as well as release the invite or the call for our advisory council for the implementation of this law po.
In section 14, letter C, in consultation with the Advisory Committee for Education of Learners with Disabilities, created pursuant to this act, other implementing partner agencies and stakeholders formulate and adopt a national policy on inclusive education and prepare and regularly update a multi-year roadmap supported by annual work and financial plans for the effective implementation of this act. So in other words, there's an interaction, there's a consultation process with the advisory committee, no? But the interagency council will be the one preparing and reviewing. I think the process there is BLD will formulate it. They will review. The council will review in consultation with the committee, the advisory committee. But we go back to the advisory committee. Without IRR, we cannot implement the IRR. But then again, let me dugtong-dugtong siya eh. Ano? Dugtong-dugtong siya. Yeah, that's why. But again, let me emphasize, the law was signed on March 11, 2022. No, the IRR was signed on July 18, 2024. No, so 2 years after. But to this point, it's not yet published. No, so the problem is publication. No, that's what's holding this back. But I'm really, to be honest, this is a disservice to our learners with disabilities. No? A delay of this long is, how can you explain that? No? Nobody will understand why a simple publication cannot be implemented. No? You just go to a newspaper outlet, you just publish it. Or you go to the official gazette, which is online, then publish it. Again, bring this up to the secretary because it's, for me, it's unacceptable, and that's why we conducted this oversight hearing. This is actually the first oversight hearing that this committee conducted because we saw that a lot of the laws that we have implemented in the last few years have not yet fully realized, and we were not remiss in inviting the DepEd, inviting the other agencies so that they will be abreast of the importance of the laws that we are crafting. But again, without doing the necessary process, then sayang lang yung batas. No? We cannot fully utilize that. Okay, so we go back to, I guess we go back to that. What we want to know is, in implementing the law, what are the steps what are the budgetary requirements do we need? And how do we, what is the vision in fully implementing the law? No, for example, how much do we need for the ILRCs? No, how much do we need for the multidisciplinary roadmap? In the same time, it will be a signal to CHED to promote different courses that will help form the multidisciplinary team, also come up with courses for our special need teachers. So it's all interconnected. So the roadmap is, we envision the roadmap as the Bible for the implementation of this law. So without that Bible, we cannot move forward and have definite targets. So that's the complication of not having that roadmap. Nevertheless, I have some more questions, but I want to hear from our stakeholders here, their comments on the implementation of the law. Ito lang bang may highlight?
Updated na.
Okay, because some of our departments and offices who are here have specific responsibilities in the law. So we want to start off with DSWD. Any comments? Because we also included in the law some responsibilities, no? So for the implementation of this of inclusive education. So any comments?
Good morning, Mr. Chair. The DSWD reaffirms its strong support for the implementation of the RA 11650, also known as the Inclusive Education Act for Learners with Disabilities. And one of the role of the DSWD, as indicated in the Act, is one of which is the provision of social and welfare services for children with disabilities. And the DSWD would like to share the continued efforts to address the needs of children with disabilities through the new project of the DSWD, which is the Cherish Project, Mr. Chair. The target beneficiary of this is the children with disabilities. It is a 12-month initiative running from July 2024 to June 2025, aimed at providing comprehensive social protection for children with disabilities and their families. It targets approximately 89,261 children identified as having disabilities from poor households. The project seeks to enhance and detect the registration of children with disabilities through interagency collaboration, provide a monthly disability allowance of 2,000 to assist families with additional cost, and improve access to essential services such as healthcare, education, and livelihood opportunities. Additionally, this project also focuses on training community volunteers to develop effective home care support and services. That's all, Mr. Chair. Thank you.
Do we have any? I know that we have a lot of ayudas, no? Parang lahat na yatang pwedeng ayuda, meron na tayong ayuda. Meron ba tayong any support from the SWD to our learners with disabilities, particularly low income or our coming from poor families, LWDs coming from poor families? Do we have a specific program for them?
That would be the Project Cherish, Mr. Chair. That is for the children with disabilities po. And it's currently on the pilot implementation, Mr. Chair. That is the pilot regions are Puerto Princesa, City of Palawan, San Jose de Buenavista, Antique, and the Santa Cruz of Davao del Sur
So
po.
meron tayo.
Yes
Oh, good.
po.
That's good.
That is the first, Mr. Chair.
Okay, and how do you dispense the support? Do you go through DepEd? What's the mechanism to dispense the support? And is it in the form of cash or in the form of
Yes, Mr. Chair. It's a
okay.
2,000 monthly disability allowance po.
Okay, okay.
Yes po.
These are for learners with disability or
For
persons
children with disabilities,
Okay, okay.
Mr. Chair.
Okay, so how do you dispense that? How do you give the support?
The data, Mr. Chair, will be based on the PRPWD of the DOH, Philippine Registry of Persons with Disabilities po.
Okay.
In coordination with the LGU po, Mr. Chair.
Okay, okay. And how do you give the support? Do you have people? Do you go to the schools, or how do you give the support to the LWDs? Do you know?
Actually, Mr. Chair, it's a different bureau who conducted the pilot implementation. But let me check. Let me check, Mr. Chair.
But that's okay. If later on,
Let me check on that.
yeah, later on when DepEd calls for the interagency coordinating
Yes,
council,
Mr.
of
Chair.
which DSWD is a co-chair, let's integrate that support to
Yes.
this law. No?
Yes,
So
Mr.
that
Chair.
it will be harmonious.
Yes
Meaning,
po.
for example, those LWDs who are going to our public schools, let's make sure that they are targeted and given support.
Yes
Because
po.
obviously, when our learners with disabilities go to school, they have to buy uniform.
Yes,
they have
Mr.
to
Chair.
buy
Yes.
books. They have to pay for their special support services. No, yung pamasahe lang is already an expense. So let's my message is, let's work with the coordinating council, because that's the whole point, no? So that the students, LWDs going to our school system, are given support by other agencies other than DepEd. Kasi admittedly, may mga gastos sila eh. No? Yep.
That is
But I'm
noted,
happy
Mr.
to hear that you have Project Cherish
Yes, Mr. Chair.
that is being implemented right now.
Yes, pilot. Sa pilot regions po.
Okay. And when do you plan that to go nationwide?
Well, after the pilot implementation, Mr. Chair, we'll have a monitoring evaluation, and if this project will be successful, Mr. Chair, this will be conducted po, on a national level.
Okay. Thank you for that. Next is the DPWH. And there's also a specific role in the law given to DPWH, in particular, the infrastructure support to LWD. So, any comments?
Good morning, everyone. Good morning, Mr. Chair. For the DPWH, as of now, we are on the process of the conduct of audit for the school buildings, and the district engineering offices is submitting the compliant of school buildings po.
Meron na bang nag-umpisa na yung audit?
Yes po.
But we're talking about almost 47,000 schools. So, meaning your engineering districts will conduct audit on all of these schools?
Yes po. The district engineering office is the one who conducted the compliance of the school buildings.
Have you started the audit of the schools? For example, ramps, railings. Have you conducted those?
Yes po.
Meron na? Do you have any? Do you have a report?
As of now, we are still awaiting for the submission of the district engineering office.
Sige, can you?
Maybe this year, end of this year.
Yeah, it's good to hear that you have started the audit, and just submit to the coordinating council and also to this committee a copy of that audit, so we can help you with budgeting. We can also help DPWH in pushing for those infrastructure requirements for learners with disabilities.
Yes, Mr. Chair.
Thank you for that. Next will be DOH. Any?
Good morning.
Yeah, go ahead, ma'am.
Good morning, Mr. Chair. The Department of Health fully support this RA 11650. As of today, sir, we are coming from 4 offices, sir, which is we are all part in the RA 11650. Just to name is one is the disability program, one is the oral health program from our health Promotion Bureau, and also a touch agency from the National Nutrition Council. Please allow us, sir, to share with you
Yes, go ahead, ma'am.
per officer, sir. The passage of RA 11223, also known the Universal Health Care Act, further guarantees that all individuals, including those with disabilities, have access to quality health services without financial hardship. The Act's provision aligned with the 8-point agenda as the health sector's medium-term strategy to achieve universal health coverage, improve health outcomes, and strengthen health systems. Recognizing the growing concerns of persons with disabilities, various laws and policies have been developed to enhance the quality of life for these individuals. RA 7277, or the Magna Carta for Persons with Disabilities, provides rights and privileges for persons with disabilities, promoting their integration into mainstream. Further, supporting this RA 7277, the Department of Health issued an order, the revised national policy on strengthening the health and wellness program for persons with disabilities, which aims to establish an effective national health program for this group. So the implementation also, as mentioned earlier, the implementation of the Philippine Registry for Persons with Disabilities was developed in collaboration with the National Council on Disability Affairs Office that further strengthens these efforts by systematically identifying and supporting individuals with disabilities. The PRPWD is a registration system where data such as general information, types, and causes of disabilities are captured. And aside from being a registry, the system also designed to assign a unique identification number for persons with disabilities to enable them to avail of discounts and other benefits. As of now, Mr. Chair, as of November 9, encoded or registered in the Philippine Registry for Persons with Disabilities, the total of 1.8 million persons with disabilities, including already children with disabilities, sir. And learners with disabilities can avail of services for persons with disabilities by applying for a person with disability identification card. Hence, learners with disabilities are encouraged to apply for a person with disability ID card, provided that they can submit the required documents to be recognized and receive services provided for persons with disabilities. As of now, we have 10 categories or 10 types of disabilities registered in the system po. Currently po, the Department of Health is also enhancing the type of disability by developing a standardized definition and categorization of disability in the Philippines. So at this time, we will have 9 categories of disabilities, namely hearing disability, intellectual, learning, mental, physical, speech, language, and communication disability, visual disability, cancer, and rare diseases. So the objective of these guidelines is to generate disability definition that will be understood by all stakeholders and utilized in assessing and providing health and rehabilitation services for persons with disabilities at all levels of healthcare in the Philippines. The DOH also planned to develop a manual of operation and training modules for this categorization of disabilities by next year to ensure the timely quality assessment and categorization at all levels of care in the country. Moreover, the DOH implements the Magna Carta for disabled persons with disabilities to provide a 20% discount and value-added tax exemption upon purchasing health-related products such as medicines and medical devices and the availability of health services. And lastly, to ensure financial risk protection, the Philippine Health Insurance Corporation provides health benefits and rehabilitation packages for persons with disabilities, specifically for children with disabilities. This includes the rehabilitation packages for those with hearing, visual, mobility impairment, and developmental disability. So, Mr. Chair, can you also share with other programs that are present here to share also their initiatives from the Department of Health?
Yeah, go ahead.
Thank you.
Go ahead. Who's?
Good morning, Mr. Chair. Good morning, everyone. For Health Promotion Bureau, sir, we have incorporated in our implementation of the Healthy Learning Institutions program some aspects of ILRC. So HLI, sir, Healthy Learning Institutions, it's mandated by the Universal Healthcare Act. It's a program, it's a multisectoral program aimed at promoting the health and well-being of both learners and school health personnel. And since our pilot implementation in 2022, sir, and 2023, and our implementation this year's current year, we have incorporated, sir, indicators on on ILRC. So what we do, sir, is we provide materials to elementary schools and that are related to ILRC, including inclusivity and well-being materials for schools. And we also have our regional offices helping us in implementing HLI program together with ILRC, sir. So as of this year, sir, we have a total of 1,500 elementary schools that are within the program. And in implementing our initiatives, sir, in these schools, we have already incorporated ILRC indicators, sir. Over. Thank you.
Thank you. Thank you for that. Any go ahead.
Yes. Hello. Good morning, Mr. Chair, and members of the committee. So I wish to read to the body the position paper of the NNC, or the National Nutrition Council. So the National Nutrition Council is the highest policy making and coordinating body on nutrition in the Philippines, and as a key partner supports in implementing the RA 11650. So emphasizing how nutritional well-being is integral to the success of inclusive education programs. The NNC poses also, we strongly integrate for the integration of the nutrition into inclusive education. We strongly advocate for the integration of the National Nutrition Council into the implementation framework of RA 11650 for the following reasons. Number one, we have the nutrition as a foundation for learning development. Research has indicated that undernourished kids are more prone to experience social and academic difficulties. Children with special needs and disabilities already work harder than their counterparts just to accomplish everyday tasks. Obesity, on the other hand, adds an additional layer of difficulty of both children and their caretakers. So furthermore, the study of Bonder in 2024 states that children with disabilities are twice as likely to have overweight and obesity than other typically developing peers. So higher weights than this individual may compound challenges already experienced in their disability, including mobility and activities of daily living. So by addressing the dietary requirements of learners with disabilities, the NNC's experience developing and enforcing nutrition rules, such as nutrition guidelines for Filipinos, among others, that would enhance RA 11650's instructional focus. Second, comprehensive support for learners and disabilities, because learners with disabilities frequently encounter complicated issues that go beyond schooling, and the law's inclusive mission necessitates a multi-sectoral approach. Third, capacity building for schools and communities. The NNC has extensive experience in community-based programs and capacity building initiatives. So this expertise can be transferred to capacitating our school health personnel in DepEd, our teachers and local government units, health personnel in integrating nutrition interventions into inclusive education programs. As an implementing agency as well, NNC can aid in the development, implementation, and evaluation of the school-based feeding program tailored to the specific needs of the learners with disabilities, and promote awareness among parents and communities about the importance of nutrition in supporting inclusive education. Fourth, alignment with existing national and global goals. The inclusion of the NNC in implementing RA 11650 aligns with the following: the Philippine Development Plan 2023 to 2028, emphasizing health and education as pillars for sustainable development. The Philippine Plan of Action for Nutrition in 2023 to 2028, the PPAN's desired vision of change, decrease in all forms of malnutrition across age groups by 2028, particularly in its commitment to improve access to quality services, where NNC emphasizes the Filipinos' benefits from well-coordinated, inclusive, and integrated quality nutrition and related services. And United Nations Sustainable Development Goals, SDG, particularly SDG 4, the quality education, and SDG 2, zero hunger. So by ensuring that nutrition is integrated into education policies, the Philippines takes a holistic approach to fulfilling its commitments to both national and international development goals. Our recommendations to operationalize this partnership, we recommend the following. First, the institutionalization of NNC representation in implementation bodies to ensure the NNC is represented in the Interagency Committee overseeing RA 11650 to align nutrition policies with inclusive education programs. Second, specialized nutritional needs, where learners with disabilities have specific dietary requirements. The NNC can guide schools by collaborating with DepEd and local government units to design appropriate feeding programs and design social behavioral change communication for nutrition education that addresses the specific needs of learners with disabilities. And also the conduct of research and data collection. We can set direction on the type of researches that our partners to prioritize. And community awareness, where to conduct campaigns to highlight the importance of nutrition in achieving inclusive education, such as NNC's NutriSkwela, among others. And to promote understanding of the link between nutrition and inclusive education through national and local advocacy efforts. In conclusion, the participation of the National Nutrition Council is essential to accomplishing the goals of RA 11650 by attending to the dietary requirements of the students with disabilities. We guarantee their overall growth and fair access to high-quality education, promoting a more inclusive and health-conscious community. So that would be all, Mr. Chair. However, this position paper is still to be signed by our Executive Director, Azucena Dayanghirang.
Thank you for that.